Onto this now, the Royal McAlpine Foundation, in partnership with Wits University, has donated 70 million rands to upgrade the burns unit at the Chris Hani Baragwanath Academic Hospital in Soweto. It's the only public health specialized burns unit in Gauteng for patients who cannot afford private treatment. A sod turning ceremony was held at the hospital earlier today. Now, let's discuss this further. We're joined by Professor Martin Smith, the head of the Department of Surgery at the University of the Witwatersrand. Prof, thank you so much for your time this afternoon.
Pleasure. Good afternoon all.
Prof, I'd imagine this is great news for the facility that's regarded as the preeminent burns treatment facility in Africa. Now, talk to us about what this donation means for the burns unit at the Chris Hani Baragwanath Academic Hospital.
Thanks, Renati. This is a very exciting time for us. We've been facing, as all health professionals have over the last 18 months, really dire situations, which has also affected the burns unit. But this burns unit is 30 years old this year, originally donated by Johnson & Johnson as a partnership with the Department of Health. And so what this means to us is that we're going to be able to extend the excellent work that this unit does. It's a unit of excellence. It's very involved in not only patient care, but also involved in training health professionals in all disciplines, nurses, physiotherapists, occupational therapists, doctors, etc., who work with these patients. And so this gives us an opportunity to continue to do that good work, but by meeting the needs of a scarce resource, as in burns units. This is a common problem. It's very much part of the fourth epidemic of trauma in this country and one of the most devastating injuries that we see. So our ability to improve the care to the patients, improve our training, and improve the research that we do in that unit, I think is very exciting for all of us. And we're really looking forward to having access to this new facility.
Prof, perhaps tell us, what are some of the challenges that you face? I mean, I know that you see 250 adults, 500 children within this hospital alone, and some of the patients that you see, as you've just said, are, in the province, outside of the province, as well as the African, continent. So what are the time frames that we will be seeing these upgrades being done? But essentially, I'd like you to tell us, just some of the challenges that you are faced with currently. I mean, these numbers are quite high in terms of the patients that you do see.
So the management of the patient with burns is a very labor-intensive and requires significant resources, particularly in severe burns where access to intensive care facilities and all that goes with the intensive care facility, ventilators, dialysis machines, etc. So this is because it's so scarce, so labor intense, and because much of the work is very highly specialized, every health professional that works in a burns unit has to be committed, has to have had the experience to managing this difficult group of patients. So the big constraint that we face is access to the appropriate number of beds. Now, the modern management of burns also requires that these patients require varying types of operations fairly commonly. And so what makes this unit really special is that it has its own operating theatre. So there are a number of challenges and a number of gatekeepers to the process. So the first one is access to ICU beds. The second one is access to intensive care for these patients. And when an intensive care bed's full, then it's full. You can't admit any more patients. And then you have to find other places for these patients to be managed, either within the hospital or in other hospitals. So what this is going to do is going to increase our capacity. We'll have more beds, we'll have more operating theatres, and we'll certainly be able to treat more patients. And so without the pressure of time and the pressure of beds, I think that the management of the patients will not be hurried, will not be rushed. And so even for the individual patient that's in the unit now, some of the pressures will be relieved by us having access to more beds and more operating theatre time.
I would imagine that would be very beneficial for the patients, as you've termed this, a traumatic experience for them being burnt. But I'd like to touch on the modern technology usage that you just brought in. I know that there will be a skin bank that will also be included in these upgrades. Talk to us about the importance of those skin grafting, etc.
So the problem with managing the burns patient is that we don't really appreciate, as non-burn specialists, the importance of the skin covering. And when you lose that skin covering, it has so many physiological and so much impact on the patient's well-being and ability to heal, that what's clear to us now is the quicker we can get the skin covered or get the patient's body covered, either with their own skin or skin substitutes or cells that we've grown, skin cells that we've grown in the laboratory, the better these patients will do, the quicker they'll recover, and the quicker all the physiological abnormalities, the kidney problems, the heart problems, the lung problems will recover. So having access to the full range of modern treatments, modern technology, I think will certainly benefit and improve, and the recovery times will be much quicker for these patients with less complications. So I think that that's what we're looking forward to. Now, we also have to, because resource constraints go across the board, we also have to look for solutions in the South African context, and certainly within the Chris Hani Baragwanath Academic Hospital context. And so we have to be exploring our own solutions to what we may do to achieve this, what we call skin coverage, as soon as possible. So I think that's where I think we're going to be able to make a significant difference as well. And having a skin bank, having the laboratories to test it, have many different technologies to evaluate the efficacy of these treatments, I think will make a significant difference to the work that gets done in that unit.
Professor Smith, let's leave our conversation right here. Thank you so much for your time this afternoon.
Pleasure. Thank you.
Professor Martin Smith, the head of the Department of Surgery at the University of the Witwatersrand.